In doing the Worst of the Food Industry video for Dr. Andrew Weil, I had a chance to analyze his high-fat, so-called anti-inflammatory diet. Now, his program does include lots of spices like turmeric and ginger, and these are plant-based products that are known for their anti-inflammatory properties, and I have nothing bad to say about turmeric and ginger. But it's the recommendation for 2 to 6 servings per week of fish and seafood and 5 to 7 servings a day of healthy fats that cause my concern. What causes the anti-inflammatory properties of this diet, after all? Is it the high content of omega-3s found in these fatty fishes? Let's find out.
Fish and fish fat, these good fats, what happens is they suppress the immune system. That's why the joints are less inflamed, because they're an immunosuppressant, an immune system suppressant. Not because they oil the joints, they suppress the immune system. Well, you suppress all the immune system, so you increase your risk of cancer and infectious diseases.
In other words, the anti-inflammatory benefits you may experience from eating a diet high in seafood and so-called healthy fats are as a result of a suppression of your immune system, which is what initiates the inflammation to begin with.
The issue on heart disease, as far as thinning the blood, if you take and you review the studies, and this has been done by major scientific organizations, what you find, if you overall look at the impact of fish on somebody's risk of heart disease, it actually shows that fish does not reduce the risk of heart disease.
Later.
Since we're on the topic of heart health, what about fish and fish oil in relation to AFib?
We also used to think omega-3s could protect us from arrhythmias, abnormal heart rhythms like atrial fibrillation. Millions suffer from the condition, which causes an irregular heartbeat and a higher risk of stroke and death. But fish and fish oil consumption does not appear effective for preventing it or treating it.
This is not a recommendation specific to AFib patients, but in general, transitioning to a whole food plant-based diet centered around starches will treat the cause of disease. You can expect to naturally lower your cholesterol to a safe level, and by cutting out the fatty animal products and bottled oils, you won't experience the sludging of the blood or platelet aggregation that comes in the period postprandial or after eating those fatty meals.
Other arrhythmias can be life-threatening and cause sudden death. Despite initial encouraging results, more recent studies have not only failed to reduce sudden cardiac death with omega-3s, but actually increased mortality in cardiac patients. For example, men with heart disease advised to eat more oily fish or supplied with fish oil capsules were found to have higher risk of cardiac death, maybe because of the contaminants in fish such as mercury. In either case, given the inconsistent benefits, the potential adverse effects, omega-3s must be prescribed with caution, and generalized recommendations to increase fish intake or to take fish oil capsules need to be reconsidered.
This kind of generalized recommendation to increase oily fish consumption and take fish oil capsules is exactly what we find on Dr. Andrew Weil's webpage, where somebody asked him a question about the studies that show that fish oil supplements do not prevent heart disease. This person had a heart attack and is asking if he should keep taking the supplements. And Dr. Andrew Weil basically equivocates and says, despite the fact that we don't have proof that the omega-3s prevent heart disease, most experts recommend increasing oily fish consumption, so I recommend 2 to 3 servings per week as well as 2 to 3 grams of fish oil per day. It's an appeal to authority fallacy, and it shows how when this man is presented with new information, he's unable to adjust his recommendations accordingly.
Fat does not make you fat. This is a very important concept. Fat does not make you fat.